most people who come to see me aren't always ill. They look perfectly healthy, they're busy professionals, they're parents, they're business owners. They're often people with enormous responsibilities, just like you, just like me. But beneath all of that, you see, there's a quiet question they carry around, sometimes maybe for months, before they finally speak with me. That little rapid heartbeat when you're in bed at night, or the shortness of breath when you walk up the hill, or the little twinge of chest pain, or the fact that your next door neighbour had a heart attack in their 40s and you wonder whether that could be you tomorrow. And the really deeper one that worries patients the most is whether they will be here for their family in the future. And these aren't fears that are irrational, they're human. I feel them too. I had a CT coronary angiogram recently because a patient of mine beat me at a VO2 max challenge, and he was 10 years older than me, and I was genuinely worried that I had heart disease. Thankfully I don't. Now, the challenge with screening in the landscape we see today is that it's just so fragmented. You'll see silver, gold, platinum packages, but these packages, they're not really built around me or you. They're generic lists and tests, and they don't really look at risk specific to the individual. They're fragmented. You get an ECG in one place, blood's in another, a CT scan somewhere else, and nobody really joins the dots. Nobody looks at the whole story. And even when you get all those results back, you're handed a long report and left alone to interpret it. This is why so many people say to me, I had everything done, I still feel not reassured. You see, a normal ECG doesn't guarantee safety. Normal cholesterol doesn't guarantee healthy heart arteries. You know all of this. A perfect echo doesn't rule out early disease. The truth is these tests are only helpful when they're interpreted together in context with someone who really understands the story. Now let me explain the tests that we can do to look at your heart in plain English so you can understand exactly what they do and, more importantly, what they don't do. The electrocardiogram, the ECG. It looks at the electricity of the heart. It tells us whether the rhythm is steady, too fast, too slow, or irregular. It can show old heart attacks and sometimes conduction problems, but it cannot diagnose coronary disease unless you're having chest pain at that point in time. And people with coronary disease can actually have a normal ECG. Now, an echocardiogram, an ultrasound scan of the heart, it looks at the way the muscle pumps, it looks at the heart valves. It's a very good test, but it's very subject dependent and also very interpreter dependent. And so you need a good individual to do this. A calcium score, a CT scan, looks at calcium in the heart arteries, the hardening of the heart arteries, but it really only looks at chronic disease and inflammation in the heart arteries. It doesn't really tell us whether there's narrowing in the heart arteries like a CT coronary angiogram does. You see, the CT coronary angiogram, unlike the calcium score, looks not only at the wall of the blood vessel, but inside the blood vessel. Unfortunately, of course, it needs radiation, so that's why you won't always have this test as a generic test. And then, of course, there's blood markers, which we often overlook, but sometimes they're probably more informative than the other scans themselves. I'll give you an example. ApoB tells us the number of particles capable of forming plaque. Lipoprotein A is a genetic test that can tell us whether or not you've inherited a predisposition to coronary disease. HCRP can look for inflammation that might be heart specific, and troponin is a protein that's released from heart muscle when it's damaged. HbA1c gives us an idea of how well your blood sugar is being controlled. And when we take all of these tests together, they can give us a really important insight into how healthy your heart is. But here's the part that hardly anyone ever talks about, and it might actually be the most important part of this entire video. The real secret to protecting your heart is not the assessment, but the follow-up. It's the trend over time, not the numbers today necessarily, but the pattern over the course of time. Not the snapshot, but the trend. Your ApoB today matters. Your ApoB in 6 months might be more important. Your calcium score today matters, but what does it look like 2, 3, 5 years from now? Your blood pressure today won't be the same as it is 5 years from now, and that's why it's important that you monitor and measure it. Your blood sugar control today may not be the same as 2 or 3 years from now. And so all of these tests need to be analysed over a period of time to ensure that these things don't change. You see, most heart problems don't appear suddenly. They develop gradually and quietly over time, and the earliest warnings only show in the trends. That's why follow-up matters. That's why it's continually important to ensure that you've got a partner in heart health. And that's where people get real reassurance, knowing that this is what it was like then, that is what it's like now, and this is what we've got to do in the future to change something. A better approach to screening starts with a proper conversation, a consultant-led dialogue about story, about your fears, about your risks. It continues, of course, with tests that are chosen for you, not just a package. It ends with a plan, a strategy, and importantly, a long-term follow-up approach that adapts as you get older and as your life changes. Because true reassurance comes from clarity, context, and continuity. If any of this resonates, know that you don't have to solve all of this yourself. You just need the right first step with someone who will guide you safely, calmly, and thoroughly. Take care of your heart. It really is the engine behind everything you do.